day everyone, my name is Selena Ashley Cortas from Our Lady of Fatima University. And for this written demonstration, I will be performing bed making with an unoccupied bed. So the first thing that we will do is gather all the equipment. So I have here all my equipment. So now, I gathered all my equipment so I can save time and energy while doing the bed making. So now, I will perform hand hygiene and wear my gloves. So we perform hand hygiene and wear gloves so we can prevent the spread of microorganisms. So after wearing gloves, we can now remove the reusable linen and fold it and set it aside. And place it here at the top of the chair. So after that, we will also remove the pillowcase. By firmly holding it and gathering the pillowcase at the bottom, and disposing the pillowcase at a hamper and putting the pillow at the clean area. So after that, we will loosen the bed linen. We will loosen all the sides of the bed linen so that when we roll it, it will be easier and won't cause any strain for readers. So uniform so that you won't get contaminated by the soiled linen. So after that, dispose the linen into the hamper so that it won't contaminate any other things that can possibly touch. So now I will change my gloves and perform hand hygiene. You can now get the bottom linen and place it in the center of the bed. So now that the bottom linen is placed in the center of the bed, we can now spread it from the upper side of the mattress to the toe. So we are going to start here. So now we will tuck the bottom sheets here in the toe of the mattress up until the head of the mattress. Tucking the linen under the mattress makes a less wrinkly linen and feel more comfortable to the patient. So after that, we will fan fold the bottom linen, and then we will get our draw sheet. We will also place the draw sheet here in the middle of the bed and fan fold the other side, so that if the patient ever soils the bed again, there will be a draw sheet here. After that, we will also get the top sheet, place it in the middle of the bed, spread it, and then fan fold it after spreading. Now we will fan fold the other side. So now that the top sheet is now spread, we can now move on to the other side of the bed. So we will start by pulling the bottom sheet here and securing it here at the head of the mattress. As we work our way down to the toe of the mattress. Make sure that it is tucked in so that it is less wrinkle free. So we will also pull the draw sheet, and after that, we will also pull the top sheet. After pulling the top sheet, we can now tuck in the top sheet here. Make a triangle here, and then tuck it in. Triangle, and then tuck it in. Make sure to tuck in the sides too. So after that, you will, for easier access to the patient, you will fan fold it here on the top. I'm putting it here for easier access when there is a patient. Now we will get our pillow and our pillowcase. We will gather the pillowcase, and by firmly holding the pillow, we will insert the pillowcase inside. So we will close the pillow. We'll place it here in the middle. And after that, I will dispose all the linens, and after disposing all the linens so that I can prevent the contamination of other things that they can touch, I will now remove my gloves and perform hand hygiene. So that is how you perform bed making on an occupied bed. So for this procedure, the first thing that I will do is review the patient chart to check for any physical limitations. So I'm checking for any physical limitations so that I can prevent any injuries for the patient. So now I have checked the chart of the patient. I will now perform hand hygiene, and after this I will wear my gloves. So now that I've worn my gloves, I have my equipment gathered here so that when I start the procedure, it will not cost much time and energy. So after this, I will identify my patient and explain the procedure. So, good afternoon, ma'am. My name is Selena Ashley Cortez, your student nurse from Our Lady of Fatima University. May I ask about your name and your age, ma'am?
I'm Stephanie Joy David, 19 years old.
Okay, ma'am. How about your birthday, ma'am?
November 23, 2006.
Okay, ma'am, thank you. So for this procedure, I will be performing bed making. So this procedure won't cause you any harm, but please tell me if you feel any discomfort now. Thank you. So now that I've identified and explained the procedure to the patient, I will now start by placing a bath towel above the patient. So now that the bath towel is placed, I will pull the linen. So I will instruct the patient to hold onto the bath towel para hindi siya sumama while I'm pulling the linen. Always remember not to hold up the linen of your uniform so that it will not get contaminated. So now that the soiled linen is rolled up, we can now dispose it and put it into a laundry hamper. Now that the soiled linen is done, I can now instruct my patient to move to the other side so I can start with the vacant side here. So ma'am, pwede po ba tayong umusog sa gilid? So now that the patient is in the side, I can now start on the vacant side here. So I will start by loosening the bed linen. Now that the bed linen is loose, I will now fan fold it as close to the patient. So now that the soiled linen is out of the way, we can now get the bottom sheet and put it in the center of the bed. After putting it in the center of the bed, we have to spread it. And then, after spreading it, we will fan fold it onto the side. Fan fold it under the soiled linen. And then after that, we will spread it from top to bottom. So after fan folding and spreading the bottom linen, we will secure it from the bottom onto the top of the mattress. Tuck it under the mattress. This allows wiggle feet. So after that, I will get my draw sheet and also place it in the middle of the bed. And then fan fold the other side too, placing it in the mid section of the patient. So after that, I will instruct my patient to move to the other side of the bed so that I can start with the other side of the bed. So ma'am, usog po tayo dito. So after moving the patient on the other side of the bed, we can now start with preparing the other side here. Excuse me, ma'am. Loosen the linens. And then fold. After fold rolling, dispose in the hamper. So after that, we will start by pulling the bottom sheet here. Excuse me, ma'am. Starting at the top, we will top it securely. And at the bottom. After spreading the bottom sheet, we will now start spreading the draw sheet. Excuse me, ma'am. Thank you, ma'am. So after that, we will ask our patients to go back into the center so that they can feel comfortable again. So ma'am, gusto mo po tayo sa gitna. Thank you, ma'am. So after that, we will get the pillow of the patient. So excuse po, ma'am, kunin ko lang po yung pillow. And then by firmly holding the pillow, and then gather all the pillowcase. And then dispose. Place it in a clean area and get the other pillowcase and then gather it again. So by firmly holding, we will insert the pillow inside the pillowcase. After that, we will place it again at the head of the patient. Yes, ma'am. Thank you po. And now we will put the top sheet. So place it in the center of the patient. And 6 feet below. And then we will spread it here. Spread it here. We have to make sure that the patient is covered. Once we remove the bath towel, the patient won't get exposed and privacy won't be violated. Make sure to tuck the top sheet here at the end and here at the corners, so that the patient can feel comfortable. After tucking the top sheet, we will now fan fold the patient so that they can feel more comfortable. So after that, I will dispose all the linens, and after disposing all the linens, I will remove my PPE and do hand hygiene so that I can ensure that there is no spread of microorganisms and I will not contaminate any other things that I will hold. So that is how you perform bed making with an occupied patient. So thank you.